One of the things that health professionals, particularly those that aren't working, who aren't sort of working full-time or they're not specialists in paediatric palliative care, so for example primary health care, people who work in adult specialist palliative care who are maybe needing to look after children because they live in a location where there aren't any paediatric palliative care specialists, or paediatric staff who are having to do the palliative care because there's no sort of paediatric palliative care staff in their region. And one of the needs that they've expressed is support around communication. And so we decided we would do a study where we would video record palliative care consultations to try and analyse what sort of conversations occurred within the paediatric palliative care context. And this was done through a methodology called conversation analysis. And our study found that it's actually feasible to do the video recordings. You might think that actually that's a bit intrusive, video recording a consultation, but we actually found that both the health professionals and the families found this was acceptable and that it didn't interfere with the interaction. And so we did a small pilot study and had about 10 interviews, and one theme that we've looked at after the initial sort of evaluation was how health professionals and families manage the difficult conversation of deterioration. So for some rare conditions or serious illnesses, there's a component of fragility for a child's condition. So for example, if they get an intercurrent illness or their condition progresses, there may be a risk that they could deteriorate quite suddenly. And then there's a need from the health professional perspective to know what the family's wishes are in that context. And what we actually found was that this was actually a topic that families were actually wanting to talk about often, and that health professionals just needed to provide a safe space to allow families to have this conversation. And so the metaphor of maybe knocking on the door rather than sort of pushing through the door is a helpful one. And two particular ways that that the conversation can be facilitated is, one is by just asking the family what's important for them to talk about today in this particular consultation. And also, when you finish the consultation, asking the family, is there anything else you'd like to talk about? And interestingly, some families actually said to us, actually, we'd like to talk about how to manage the situation if our child deteriorated. The other sort of strategy we found was related to continuity of care, and this is where a health professional may know a family from diagnosis. So for example, diagnosis of a serious or rare condition, and this health professional has sort of journeyed with the family, and there may have been previous situations where a deterioration has occurred and there's been some initial discussions that's occurred. So the health professional can then draw on those previous experiences and say, like, for example, remember just before Christmas last year, John was in hospital and he had a deterioration, and we had to discuss whether he would go to intensive care, and actually you might be speaking to John's mum and you say, well, actually we had to get Dad to come in and have that conversation as well. Do you think with how things are going at the moment, with John being readmitted to hospital, whether it might be helpful to revisit those conversations? So that's another sort of strategy, and in a way getting permission from the family to have these difficult conversations. So as one of the outcomes of this research is that we've now got these real world conversations that we can actually use the video recordings to develop education resources, so that health professionals can watch these consultations and also sort of have some learnings and teachings around that. So it becomes a very powerful research, not only a research tool but an educational tool. And we have actually developed our first online module which relates to who is the expert in the management of a child's condition, and it brings out the expertise of both the health professional and also the parent. And as you would know, with many families who have got a child with a rare condition, they often know more than the health professionals do. And so it's trying to bring the best of the knowledge, expertise, and allow what we think is probably the best way of decision making, which is shared decision making in terms of the decisions around the care of a child who's got a serious illness.